Hello, my friend. Welcome to the chiropractic clinic. What brings you in today? Having some pain in your wrists and a little bit in your neck, huh? Okay. So, tell me, what do you think is causing that? Lots of typing, looking down on your phone. Yeah, I see that a lot these days. We call that tech neck. And it's a problem. We all sit there like this, looking at our phones all day, and that's not a natural way for your neck to sit, and it shouldn't be bent like that for hours on end as we scroll. So why don't we take a look at you and we can see if we can get you feeling better, okay? Alright, great. Alright, so first things first, let me come up here. I'm just gonna feel your neck a little bit. Okay. That is very tight. We can work on massaging that out a bit. Yeah. Okay. Yeah. I can feel a little knot there. In the top of your spine. Right in the peak of your trapezius muscle, so we'll work on that. And do me a favor, can you turn your head to the side a little bit? Okay, good. How about the other side? Your range of motion seems a little bit limited. We'll do a little work on that and we'll dig in real deep and we'll work those knots out for you, okay? And how about your wrists? You said you were feeling some pain in your wrist too, right? Lots of typing. Are you doing one of these? Balance your phone right here on your pinky and then swipe with your thumb all day? Yeah, see, unfortunately, that stretches your hand out in a very unnatural position, which can lead to some strain in your tendons. So that's probably what's causing you your pain. So what I'll do today is I will work on massaging that out a little bit, and then I'm also probably going to use some Kinesiology tape or KT tape and tape up your wrist, provide a little bit more stability in there. That should help alleviate some of your pain, and I'll even show you how to apply it yourself at home. Alright? Fantastic. So first things first, I want to take a look at that neck. So I'm just going to use a little of this vitamin E oil. It also has a little bit of CBD in there that should help reduce the inflammation a little bit. Okay, so I'm just going to come up here and I'm just going to use my thumbs and I'm just going to start running them down the sides of your neck. Alright, just like that. Let me know if it hurts at all, okay? Alright. There we go. I'm just gonna slowly work my hands down your neck, pressing in just a little bit firmly. A little firm. I gotta work that knot out. Okay, let me see here. Yeah. It's gonna rub in there a little bit. Okay. This may need a little more work than I thought. Well, I promise we'll get you feeling okay. How's that feel so far? How's that feel so far? Good. Okay. I think what we're going to do is I'm going to use my massage roller here. It's very smooth. Put a little of that oil on there so it glides over your skin nicely. And what we'll do here is just run this around your neck and we'll get you feeling better. Alright. Okay. Alright. How's that feel? I'm going to press a little harder, okay? Alright. Don't worry. I won't hurt you, I promise. No, we're not going to crack your neck. I promise. We don't do neck cracking here. It's shown to not be very helpful, to be honest. It can sometimes even lead to more aggravation. We focus on therapeutic massage to help treat our patients and make them feel better. Yep. Just try to relax. It's alright, close your eyes if you'd like. Just try to relax, breathe. I know this can feel a little intense, so just breathe. Just try to focus on letting go. Try to imagine your muscles just releasing all their tension. Very good. Okay. I'm just going to run this slow. How's your neck feel so far? A little bit better? Alright, let me go just a little more over here. It's really where I felt the knot the most. I really want to make sure we get that out. Yeah. You know, you gotta try to be conscious of how you hold your head, especially when you're looking at your phone. If you ever notice, it can even happen involuntarily. You're looking at something, and the next thing you know, you've been scrolling for an hour. And you've just had your head bent down in an unnatural position. So we really got to be careful of that these days. I know it's easy to get lost on your phone, but it's always good to take a break, roll your neck a little bit, shrug your shoulders, lean your neck side to side, and really stretch out those neck muscles. Even when you're working, if you sit all day at a desk, it's good to get up for at least 10 minutes every hour, walk around, stretch a little bit, loosen up your back. All the muscles are connected. You want to make sure that, you're keeping your body in good shape. And hopefully we can prevent these kinds of things in the future, Alright, how's the neck feeling? Very good. So, your wrists, pain in both? Okay, that's alright. We'll take care of them. So, first I'm going to feel your wrist here. Yeah, it definitely feels a little bit tight. It's okay. We'll work that out. How about this one over here? Do you play computer games too? Yeah. About how long do you think you spend on an average day typing? Okay, so we're going to use a little more of this CBD infused oil. Alright. Gonna get my hands nice and warmed up. Alright, so here we go. Okay, I'm going to start over here. We're just going to really work that wrist. Just really get in there. Loosen up those muscles. Definitely think we're going to have to use the roller for this one, so. Now I'm going to press a little more firmly in here, right on the inside of your wrist. Really try to break up that tension. You let me know if it hurts at all, okay? I'm going to run that up and down your arm. Up and down. Very good. How you feeling? You doing okay? I know it can feel a little uncomfortable and a little weird, but bear with me. You'll feel a lot better after this, I promise. Okay, this side looks pretty good. And that's the side we're going to tape up. But let's check out this other side here. Let me dig in a second. This one doesn't seem as tight. Let's give it a little of that roller treatment, shall we? This can feel quite relaxing. I use this on myself all the time. It's great to work into knots in your muscles, or even just help alleviate everyday stress. You can use one of these on your feet, on your calves, on your wrists, on your neck, and your shoulders. And these are available pretty locally. Any sporting goods store should have one, if you'd like to get one on your own. How does that wrist feel so far? Good. Okay. Okay, my friend, how are you feeling? How do those wrists feel? Good. How's your neck feel? A little better? Good. Look straight at me. Just do this for me. Lean your head this way. Just give it a hold. And bring it back up. And lean this way. And hold. And bring it back up. Alright, good. Looks like you have a little more range of motion. That's fantastic. So, for your wrist, I'm going to use what's called KT tape, or Kinesiology tape. And what this is going to do is this is going to help just reinforce your muscles in your wrist for a little bit, give them a little extra stability. And this should also help alleviate the pain. Alright? And no, it won't stick to you forever. This naturally comes off in about 12 hours. You can peel it off earlier if you'd like. It won't hurt. It's not like ripping off a band-aid. This comes off pretty easy. And once I apply this to you, I will then also show you how you can do it at home, alright? Great. Okay. So, this you can also get at any regular sporting goods store. And for you, we're going to end up using 2 pieces. Alright? And this can be configured in multiple different ways. And you can use it on multiple areas of your body. So, first I'm going to ask you to hold up your arm like this. Alright? Make a small little cut inside the tape. Give myself a prong. And what I'm going to do is I'm going to pull the backing off a little bit at a time. Just a little bit at a time. It helps if you have a little bit longer fingernails than me. But that's okay. Alright. So first I'm going to do is take these 2 small ends. I'm just going to wrap them around your thumb. Alright. And I'm going to pull that a little tight. Okay, good. And then I'm just going to slowly there we go. Peel off the rest of the paper and lay that down across your wrist. Good. Okay, now hold your wrist still. Hold your wrist still. Hold still. Now, I'm going to have to rub this pretty vigorously to create a little heat. Just a little bit of friction heat. Okay? What this does is help the adhesive on the tape really stick to your skin, so it won't move or come off. Alright, how's that feel so far? Good. Now hold up your wrist for me again. Just see how much we'll need. Okay. I don't have to cut off too much, just about that much. There we go. Good. And what I'm going to do is I'm going to wrap this piece around your wrist which will give you a little more stabilization. So we're just gonna stick that and rub it to the existing piece of tape. And we're gonna just slowly peel that off. Good. And get that wrapped around. Get that wrapped around. Nice and firm. Not too tight. We don't want to cut off circulation, but just nice and firm. Okay. Just gonna rub that a little bit. Don't worry. Good. Just get rid of this paper for a moment. How's that feeling? Does your wrist feel a little bit more stable with that on there? Good. Yeah, it should feel a little bit better. And even when you're typing, it should feel just fine. Would you like to know how to do it at home? Just in case this does end up working for you and you'd like to try it out for about a week. You know, wearing it for about a week should really help your muscles restabilize in your wrists, and you should feel a lot less pain. So I'll teach you how to do it on your own. So, for a basic wrist wrap to help with that carpal tunnel syndrome, you're going to need 2 pieces of tape. So we're going to want one, and we're going to want number 2. Alright. And I'll show you on myself. So, like before, we're going to take our tape here. Alright. You take one end, and what you're going to do is you're just going to cut right in the middle. You're just going to go up about 1.25 inches to 1.5 inches. Alright? And then you want to take the paper off the tape on one of the 2 pieces you just made. Now, when you're doing this by yourself, I find it a lot simpler to wrap your thumb with one side and then do the other. So what you're going to want to do is you want to put the split right here at your thumb. And you're going to take this one piece and you're going to wrap it to the base of your finger. Now, you don't have to pull it tight yet. And then you're going to take the tape, peel off the other side, peel that down, and yes, this will give you a workout in finger dexterity. And you're going to wrap that right around so it looks like that on your thumb. And now you take the back of the paper and you peel it off slowly, because you don't want this to snap. You just want it to come off just like that. Now what you're going to do is you're going to take it and you're going to pull the tape. As you can see, it's sticky and stretchy. And you're just going to pull down, down, down the side of your arm just like this. Okay? I'm just going to press it right on, just like that. You don't have to give this one too much of a stretch. You want to press it into your skin, and then you want to rub it. You need to rub it quickly, just to cause a little bit of friction. You want that little bit of heat to help activate the glue. Okay. And once it's on like that, we're going to take, as you can see, sometimes it'll pop up right here, which is why we use the second piece to stabilize the first. So for the second, we're not going to do any kind of cutting. We're just going to take the end here, and you're going to peel off about 2 inches, just like this. And what you're going to want to do is come to the base of your wrist and put it on. Make sure it adheres to the other piece of tape. And then again, peel. Let that come off. And then we're going to wrap this around and stick it to itself. Press and hold. You can also do a little bit of rubbing like this. Activate that adhesive. And there you go. You're all ready to type and work again. And that should help alleviate your pain. Alright? How you feeling? Good. So, I'd like to see you maybe in a couple of weeks for a follow-up, alright? You can make an appointment on your way out. Have any questions? No? Alright. I'll see you in a few weeks. You have a wonderful rest of your day. Bye-bye.